Hello, everyone, and welcome. I'm Tracy Anderson, Rise Association Marketing Coordinator. For those of you that are new, we are delighted you have joined us for today's webinar titled Star Ratings Reflections, presented by Cotiviti. Today, we are joined by Misty Snodgrass, Thelma Belli, and Cassie Yazzo, who will be moderating. Thank you all for being here. Without further ado, I will let our panelists take it from here.
Thank you, Tracy, and hello, everyone. Welcome to today's webinar, Star Rating Reflections. I'm Cassie Yazzo, Product Marketing Director here at Cotiviti. Thank you so much for joining us. I'll be back at the conclusion of today's presentation to pose your questions to our presenters. We do encourage you to submit your questions throughout the presentation rather than save them until the end to ensure we have adequate time to answer them. With that, let me introduce you to our speakers. As Director of Market Strategy and Government Programs, Misty Snodgrass is focused on improving healthcare outcomes through Cotiviti's consumer engagement solution, ELISA. With more than 20 years of experience in federal and state health policy, safety net providers, and health information technology, Misty works with clients as a subject matter expert to develop and implement member engagement strategies around government-sponsored programs, including Medicaid, Medicare, and Marketplace. She has worked with states, providers, health plans, community-based organizations, and foundations. Misty has over 2 decades of experience working with underserved populations, including individuals with serious mental illness and substance use disorders that are experiencing homelessness and justice involved. Thelma Belli is a STARS analyst supporting Cotiviti's brand new Star Intelligence solution. Her primary responsibilities are to offer individualized support to our customers in reaching their Star Ratings goals through data validation, gap analysis, and results-driven interventions. Thelma works with Star Intelligence clients to identify a personalized path to sustained Star Rating improvement. Thelma has 8 years experience working with STARS, coming from a 5-star health plan in Florida. And now, let me kick it off to Misty to get us started.
Wonderful. Thank you so much. And I appreciate you joining us on, I think, a really timely subject as the Star Ratings recently came out, as you all know. We're going to go over what we're going to learn today. And then we'll be able to provide both highlights from the 2023 Star Ratings, some measure changes and updates, and recommendations for ratings improvement. The stakes are high. Good ratings yield significant benefits for plans in the form of bonus payments, the ability to charge more than benchmark payments, and a leg up on marketing to enrolling new members. An increase on even having a half-star can have a significant impact to health plans. We first wanted to start out with a poll, and we wanted to cover what are the biggest pain points when it comes to your STAR measure. So if you could vote on this poll, we want to be able to make sure we cover the issues that are most important to you. We hope to hit on these, but we will spend special time on those measures that are issues that are most important to you. So feel free to select the first one, which is increased weight of CAPS measures, medication adherence and pharmacy related measures, actionable and accurate data, inspiring behavioral change for members to take the next best action, and data management and multiple vendor relationships and processes. We'll give you a moment to vote, and I look forward to seeing the results.
Still have quite a few responses coming in, so I'm going to give everybody about 12 more seconds.
Sounds great. All right, well, it looks like the increased weight of CAPS measures, no surprise, was definitely the leader. And then although are closely tied, following that, but medication adherence, which makes sense. And we will cover all of those issues and important elements in our presentation, but we will also spend extra time on those things that are most relevant and your biggest pain points. So we're just going to hit on briefly some of the market trends and issues that I'm sure you guys are experiencing each and every day. We know how we got to where we are, and so we're just going to provide just a basic overview on some of the landscape to level set. As you all know, the rising cost and shifting of populations, the public health emergency has had a significant impact on both Medicaid and Medicare and the shift from commercial markets. Regulatory uncertainty, I'm sure in each of one of your daily activities, you're seeing regulatory uncertainty impact what you're doing, whether it be from telehealth to all the other types of regulatory changes that have occurred since and during the pandemic. Also, provider consolidation, I know, is a significant issue, as well as rising consumerism. That will be a significant portion of our presentation because it's getting more and more important to be able to meet members' needs and member satisfaction. And then payment innovation. Every health plan that we talk to talks about how important payment innovation, value-based reimbursement, and also the impact of that consumerism is driving their reimbursement rates with their providers. And then digital disruption. You can't underestimate the power of how the pandemic accelerated digital disruption. And so payers are now leveraging data, remote patient monitoring to be able to, meet certain measures. And so, we wanted to make sure we covered those as basic high points, but also wanted to be able to show how they tie into star measures and driving what's going on in the market. With Medicare Advantage growth, we call it the sky's the limit. There are over 28 million Americans that are currently enrolled in plans across the country, which is an increase, and we continue to see increases every year. Also, there's a significant amount of individual, plans that are going, and the number of plans that are ever larger than ever are available for members to choose from, which is really important in this consumerism, consumer choice, making sure that members are satisfied, that health plans are meeting their needs and meeting them where they are. And then also, we know that health plans are heavily invested in achieving the highest star rating to capture as much of the market as possible to achieve bonus ratings. And then we also know, as I said earlier, the impact of just improving a half star or some of those heavily weighted star measures can significantly impact health plan financial performance as well as their clinical performance. Without further ado, I'm going to turn it over to Thelma, and she's going to provide some highlights from the 2023 star ratings, and I'll come back in a little bit and talk about recommendations. Thelma?
Thelma, it looks like you're on mute.
Mm-hmm.
I didn't know how to unmute myself. Hello, everybody. Thank you, Misty. Like she said, my name is Thelma Belli, and I'm here to talk to you about the 2023 star ratings. We're going to go over the highlights and the updates and changes, right? So let's begin. 2023 saw record-breaking decreases because of 2022's heavily inflated star ratings. So let's take a look back at what caused the number of 5-star plans to nearly quadruple in 2022. To begin, to account for changes in care brought on by the pandemic, CMS granted relief to all plans under its extreme and uncontrollable circumstances policy. COVID's impact on members' ability to receive care resulted in CMS relaxing its standards for measuring plans during the 2020 COVID-19 public health emergency. They did so in these 3 ways. Firstly, for most measures, plans could use the better of methodology, enabling them to use the better of rates from either their current 2020 or their historical 2018 data. Yes, as far back as 2018 data. Nationally, this provision was used for an estimated 21% of measures, resulting in the artificial inflation of approximately 16% of the plan's overall rating. Meaning in 2022, plans benefited really from only performance improvements because any deterioration in measures was just covered by the better of methodology. Imagine what would your final GPA have been if you had been able to swap out grades from the previous 3 to 4 years. Secondly, CMS's continued COVID concerns were reflected in the last minute release of the August 5th, 2021 memo announcing the 2 HOS measures, improving or maintaining physical health and improving or maintaining mental health, were removed from display for 2022 and 2023. This was due to the unprecedented health impact of COVID-19 disproportionately impacting seniors. It was felt that the reliability of the results of these 2 measures would probably be skewed downwards, and that's why they were removed. This actually resulted in an unexpected increase in overall star ratings because of these two heavily weighted and consistently challenging measures were removed. Lastly, the CAHPS member experience measures were at a weighting of 2 in 2022, but doubled to a weighting of 4 in 2023. Seems like five-star recommendations aren't for Amazon anymore. Not so subtle shift in importance of clinical measures and a not so subtle shift from importance of clinical measures to member experience and the perception of care spared 2022 while pummeling plans in 2023. This highlights the plans that haven't gotten ahead of the abrasion members have felt since the pandemic. Relative weights for most clinical HEDIS measures remained as a weight of 1, showing this is not an area of increased focus at the moment. This strange year of unprecedented improvement in STAR performance is likely only a one-time anomaly, since the end of the public health emergency and the changes to methodology used to calculate STAR ratings moving forward. Next slide, please. There's no doubt that the vast amount of COVID relief granted by CMS artificially bolstered the 2022 ratings. Experts predicted it would be a challenge for plans to maintain the high ratings as many plans experienced in 2022 when moving into the post-pandemic landscape. And it's most evident in the historical drop in average of overall STAR ratings following the 2022's historical high of 4.37 to 2023's historical drop to 4.15. As I mentioned, this was not unexpected. We're now seeing what happens when STAR ratings return to a truer reflection of performance that was previously hidden among the regulatory relief from the COVID public health emergency and CMS's implementation of several methodology changes for 2023 STARs. So what are these measures? What are these measure changes? I keep talking about them, right? So let's talk about them. As plans continue to regain their footing post-pandemic, CMS implemented several rating methodologies changes for 2023 STARs. Now this sends a clear message to plans that the COVID disaster provisions are over, and CMS is increasing its scrutiny for accuracy in their assessment of plans. The first change was very much expected, the end of the overused better of methodology for 28 quality and measure performances. These no longer apply universally to all plans. This change should cause plans to revert back to scores from the ratings of years before, but those plans whose score deterioration was covered by the better of methodology, they could see an even larger decrease in scores. Second was the introduction of new guardrails. These limit the new guardrails are for the cut points. This limits the year-over-year change in both directions to cut points. This will make cut points both more challenging and less volatile in future years. The new guardrails will make cut points more stable for plans scoring lower and unable to break into the next half-star rating. Please note, all CAHPS measures are excluded from these guardrail provisions. Lastly, the new 2-key outlier removal methodology, where deletion of outliers will make it more challenging for plans to maintain or improve STAR ratings due to the resulting relatively higher cut points for certain measures. Poorly performing plans will no longer bolster the ratings of other plans, thus making it harder to achieve higher rankings. There is no room to hide from the impact of these changes, and there's no room to increase unless you make changes. As we dive deeper into the 2023 STAR ratings and move into recommendations for 2024, leaders, please understand the must-have importance of visibility into your actual plan performance. The plans to recover from any decrease you may have seen in 2023, and how to properly implement budgeting and member engagement initiatives for the remainder of this measurement year. So you might be asking yourself, Thelma, how did the methodology changes mentioned in the previous slide affect cut points in 2023? Great question. So happy you asked. Almost 50% of cut points eased. Represented on this chart, you can easily see in the first row that there's a vast increase of easier to earn 2, and 3 stars versus those of the 4 and 5-star cut points. This no doubt will make a greater widening of the gap between lower performing plans and higher performing plans. If your scores remain, the scores that didn't remain the same, that increased greatly, were the medication adherence measures. So if you were performing the same year over year, you probably saw a decrease this year. A final mention on cut points. Remember, CMS doesn't arbitrarily set cut points, but rather the collective performance of plans, and each measure creates the cut points. The decrease performance across all 2023 star ratings was the first ever where the cut point methodology provided plans relief to account for this decrease. But yet, the decrease in plan performance didn't happen arbitrarily either. The two changes CMS set into motion, increasing the measure weights from 2 to 4 for patient experience, complaints, and access measures, and the 2 key outlier deletion, CMS knew that these changes would cause some shifting downward in overall star ratings. And the aggregate savings of this downward shift would save the Medicare Trust Fund $4.1 billion. This is an estimation from 2024 to 2030. So how do you protect your plan from losing quality bonus payments? By accounting for cut point changes when predicting plan performance. While robust reporting and dashboards are vital for tracking progress and closing gaps, plans need to stay one step ahead with solutions that can project not only their future performance, but also how the entire industry is trending. Lastly, a recent McKinsey analysis projects that cut point changes could impact plans by as much as $800 million in 2024 star ratings alone. It suggests also that we plan quickly to identify at-risk measures and launch targeted initiatives to address them. Now let's look at the star rating composition based on rating changes from 2022 to 2023. As you can see immediately from the change of size in the dark blue piece, patient experience is CMS's top priority. Is it yours? Many plans are now inspired to expand their focus on their member experience program, since member experience and access measures are growing a substantial part of this pie, and their spotlight continues to grow. Misty, if you had to place your bets on where to put emphasis on your plan or your plan of attack, what areas would you focus on?
You know, I think, thanks so much for that question. I think our audience is already on it and one step ahead of us. Definitely member experience, CAPS measures, and treating them, you know, more than just a one-time event. So doing as much as you can for the member journey, and I'll be providing some recommendations how to map that out later. But absolutely putting your bets where, you know, you're going to be most heavily impacted. Our audience is clearly astute and already on it. And hopefully we can give you some real tangible, concrete ways to improve your star ratings and some of these key pain points that you're currently experiencing.
Excellent. So as we wrap up changes, let's talk about Part C's new measure, controlling high blood pressure. It moves into the 2023 star ratings with a weight of 1. Part D, statins used in persons with diabetes measure, was recategorized from an outcomes measure to a process measure with a reduced weight from 3 to 1. Lastly, rheumatoid arthritis management is retired from the Part C list of measures. If you'd like, I welcome you to scan this QR code on your screen to download Cotiviti's CMS Star Ratings calendar as a reminder of proposed and confirmed changes to the CMS Star Rating system. We have a summary of major updates from 2023 Star Ratings through 2026. And if you need help building a strategy, Cotiviti tracks and applies CMS updates to measure and weights into our new Stars Intelligence solution, helping our clients get ahead of anticipated changes. We'll have a link at the end of the webinar to sign up and learn more about our Star Intelligence solution, or feel free to contact us at any time at answers@cotiviti.com. Now let's talk numbers. The yearly release of the Star Ratings roughly 1 week prior to open enrollment on October 15th is no coincidence. CMS implemented the Star Rating system back in 2008 to assist beneficiaries in finding the best plan available to them by posting scores on the CMS Plan Finder. This website is available to the members to sign up, and so having our scores out there for everybody to see is a great way to help members pick a plan that's best for them. The requirement for price accuracy reporting on this website, the MPF website, is so rigorous. It was the only measure not to drop from 2022 to 2023. Isn't that funny? As expected, a significant number of plans that earned 4 or more stars in 2022 were unable to keep it for 2023. The record high of plans in Medicare Advantage plans offering drug costs with a 4 or more saw a sharp drop from 68% in 2023 to a sharp drop to 51%. Finally, 72% of people currently in MA drug coverage plans are enrolled in one with 4 or more stars or higher. That was dropped from 90% in 2022. So it's hard to, so how hard is it to be a 5-star plan without Part C? Of the 62 contracts awarded 5 stars, 57 of them were MAPD plans. So what does that mean for Part D plans? Let's continue on to the next slide to find out. The trend in the average Part D ratings weighted by enrollment for standalone PDPs decreased sharply from 3.7 in 2022 to 3.25 in 2023. CMS also reported that 31% of standalone Part D plans active in 2023 received a star rating of 4 or more, a vast decline from 2022's 54% of PDP plans receiving such a star rating or higher. In 2023, weighted by enrollment, about 9% of enrollees in these standalone plans were in contracts of 4 or more stars, a vast decline from 2022's 42%. The agency added there were 62 contracts that have 5 stars, with 2 of them being PDPs. These numbers clearly highlight the importance of MAPD's focus on Part D measures, as it is nearly impossible to receive an overall 5-star rating without your Part D overall rating also being a 5-star. If you don't think so, just ask the 52 PDP plans that missed it. 2023 continues to break records, and not in a good way. For the first time in Star Ratings history ever, national average ratings saw widespread quality measure performance decreases for 65% of measures. Despite the cut point calculation changes that assigns ratings accounting for these drops, the national average rating still decreased for 85% of measures. With only one measure added in 2021, that's the controlling high blood pressure, the performance struggle shines light on the real-time struggles of well-known and well-established measurement areas. The truth is in the numbers, and not just in the expiring of the extraordinary pandemic-generated grace period. The 2022 inflated averages gifted many plans with financial gains in 2023 payments. We encourage plans whose ratings drop to look at their current ratings and pre-COVID ratings to objectively scrutinize stars investments and work plan for areas of needed improvement. On this slide, we've highlighted 10 quality measures that benefit from implementation of optimized member engagement strategies. These include implementing outbound communications to set member appointments and overcoming objections to close gaps in cares, having accurate and easy access to member care gaps across every touch and multiple avenues of communication with members, i.e. calls, emails, texts. Plans that lead on quality will have substantial advantages to better serve their members. Maintaining a 5-star rating, maintaining a star rating of 4 or higher can help plans remain financially stable, offer rich supplemental benefits of members, and compete for the 55 to 56% that the enrollees base their decision on which plan to use. But congratulations are still due. In all, 57 contracts did earn 5 stars. 11 of these 5-star contracts didn't accomplish this feat back in 2022. These plans deserve a standing ovation. Some of the major parent companies earning 5 stars are Kaiser Foundation Health Plans and United Health Group. Kaiser plans earned 5 stars this year, while 9 5-star plans belong to companies owned by United Health Group. Humana and Highmark also boasted numerous 5-star plans. 67 contracts earned 4.5 stars, and 136 earned 4 stars. Also important to highlight should be nonprofit organizations were more likely to receive higher ratings than for-profit organizations. And additionally, Medicare Advantage contracts that have been in the program for 10 years or more were most likely to have 4 or more 5-star ratings compared to contracts with less than 5 years of experience. So it's important who you work with. If you're not as experienced, you want to make sure you have an experienced team with you to help you get to where you want to go. Now, Misty, you're going to talk about recommendations for improving these rates.
Yeah, thanks so much, Thelma, for that very insightful overview of the current ratings. And now we're hopefully going to be able to help provide you some of those tips to address some of those pain points. So here's just a few high-level things that I want to highlight, and we will go in deeper as we proceed through the presentation. But one of the key things that I think is so important for health plans that I think oftentimes gets missed is essentially that first impressions do matter. The secret to improving and maintaining high star ratings requires a year-round effort to drive better member experiences, higher engagement in preventative care and chronic condition management, more responsive to member concerns, and transparency around prescription drug cost. We know that those first impressions matter. That's when the first interaction, and oftentimes, as Thelma was, elucidating to, is essentially around their prescription drug. That's oftentimes the first time they have their interaction with their health plan is when they're going to go refill their medications for the first time. So that first impressions matter, but that's just the start. You have to have a continuous relationship and engagement with your members to make sure that they are you're meeting their needs throughout their member journey. Also, it's super important to have targeted outreach. So just as I mentioned, impressions first matter on first impressions. Onboarding is absolutely critical. Medication adherence is absolutely critical. Member experience, preventative screenings. I know you're hearing a theme because it's what you're experiencing every day. We know that, as we spoke earlier, that there's so many plans out there for members to choose from, and consumer and member experience is so important for members when they're making those decisions. We know that members have no shortage of options available to them and won't hesitate to shop around for a better price, better coverage, or more important of all, a better member experience. As churn rises and member acquisition costs grow, it is unsustainable for payers to continue to reacquire members annually. Instead, we recommend payers continually to consider the opportunity to encourage current members to enroll in supplemental benefits, sign up for reward programs, and schedule annual wellness visits. Also, for returning members, plan changes can result in disenrollment. Which members will be most impacted by formulary changes? Which member cohorts are at the highest risk for leaving the plan? Once you've identified these members, you're able to reach out, be transparent about the changes, and this communication can be delivered automatically, answering benefit questions proactively, redirecting members to the ANOC letter, and reducing call center volumes during this absolutely crucial and impactful time for members. It's critical for MA plans to solidify their strategy for their open enrollment period as we're going, and just as much as it is for AEP. Resolving problems quickly and making rapid adjustments when call volumes and customer complaints tend to increase. The plans need 80 or 90% of their members adherent to their chronic disease medications 80% of the time. They can't afford just to start getting them on their medications halfway through their performance year. Better CAP survey scores directly translate to better star ratings, especially with the increase in the member experience weighting. Starting CAPS communications a month before the survey goes out is way too late. To create informed, satisfied, and loyal members, you must put a coordinated CAPS communication strategy in place that is year-round. We also need to make sure that you have meaningful interactions. So capturing member data, having members update their addresses, focusing on health equity, screening for those, barriers to care, whether it be prescription drug costs, transportation barriers, food insecurity for individuals that have diabetes and they're getting their, meals through a food bank. We also must provide members the right resources and make them easily available to them. And you must empower and train your member care services team. They are absolutely your arm in the field, and they're having the most interactions with your members. And they really need to be trained well to be able to answer questions. I highly and strongly suggest motivational interviewing training to be compassionate, be empathetic, so that your members are feeling that they're cared for, they're heard, they're listened, and their interactions are meaningful, and that they know that you are wanting to help improve their lives. There's trust barriers in this population. And so we really need to make sure that we're meeting members where they are, we're hearing them, and you're able to direct them to the next best action, as well as improve, your ratings as well. So, this slide cannot be underscored. As health plans have been primarily focused on gap closure, especially related to star ratings. And as, Thelma, alluded to earlier, essentially that CMS's, that's not enough. It has to be focused on the member experience, and they need to have a delightful and pleasant experience. And so we have this slide here to talk about all of the things that are going on in a member's life, and how you can engage, what's going on with them. And we highly recommend you review your member data frequently. You identify who you can impact the most. Prioritize care transitions. Those are one of the things that, a member coming out of the hospital, post-hospital discharge, an ED visit, that's when you're going to be able to engage them and be able to, meet them whenever you're having a key member experience opportunity to leverage. We also recommend that you proactively engage your members. Don't wait for the bad thing to happen, but proactively engage them. Some of the work that we were doing for Medicare members was around the hurricanes. So we were informing them related to their refills, what was going to happen. Prior authorizations would not be an issue in their area, what to go do next. Be there for their members in their time of need is absolutely when they're going to remember you. And when it comes to CAHPS ratings, your happy members are less likely to be telling them when they're happy. Most people that are going to be, providing feedback are going to be the people that had a poor experience. So try to use every part of the member journey to impact your member experience. We also recommend reviewing and implement any process improvements. Some of the things that you could be doing is MOX CAHPS. It's critical for MA plans to track and manage a member's likely response to a CAHPS survey. You can take tactical steps to uncover the inherent difficulties of survey-based customer insight systems. These targeted surveys should be thoughtfully timed, for example, after a call to a care center, and tailored to maximize response rate, hone in on the highest priority journey elements, and capture the kinds of sentiment likely to influence CAHPS scores. And as I mentioned, MA plans have to move away from just focusing on gap closure to a holistic view of the member experience. Advanced analytics can sharpen this view and help identify the most impactful interventions, and customer experience investments can improve STAR's performance and health plan economics. But they can also present a way to improve the member experience of a complex and often frustrating healthcare system at a time when healthcare has never mattered more. The trust is often broken with these members, and so it's absolutely critical that you work to have every interaction be meaningful and be built on and work to establish trust. Prior authorizations, as I mentioned earlier with the hurricanes, can be a pain point for health plan members. Manual processes can lead to delays in members receiving their care they need. Sometimes they require to wait up to 2 weeks for these authorizations that need a more thorough review. These delays to critical care can impact a member's health and how they view their health plan. Additionally, some other issues that can impact the member experience: hold times, call center experiences that I mentioned earlier, making sure your team is trained to be able to respond to difficult conversations, grievances, rejected claims, copays, etc. And make sure that as I mentioned, all your care measures are focused on as you go through your star ratings, and review members who are admitted to the hospital with frequency each year. Understand which providers and hospital systems you need to shore up data sharing with so that you can help to improve any care transitions. Identify and screen for social determinants of health so you can determine who is having those barriers to care and what you can do to impact it. For example, we looked at our Medicare members, and the highest risk factors we saw around social determinants of health were related to living alone and few social supports. Those were most likely to impact both care gaps as well as impact member experience. They don't feel like their health plan is meeting those needs. They are more likely to have a bad experience with their health plan because they're not able to focus on it. It's Maslow's hierarchy of needs. You focus on your basic needs, then you're able to go work on your healthcare needs. Also, we see high rates of housing instability and transience that impacts members. So worried about where they're going to live, another Maslow's hierarchy of needs, food insecurity. Where am I going to get my food from? I get my food from the food bank. It may or may not be the most nutritious thing that I can have. And then the next thing that we have seen through the pandemic, as to be expected, the lack of mental health resources for seniors and supports in their community. Here is how we approach how you can approach managing member health. So we analyze the data, we look who to reach, we look at how to reach them. What is their preferred way to be reached? What is their preferred language? And then we gather actionable patient and member data and begin to micro-target those outreach interventions. And then you're able to address high-risk members immediately to mitigate those issues, immediately engage them on their member journey. And then we're able to intervene, go beyond the message and help them take action on their health. Do you need connection to transportation? Do you need help scheduling an appointment? Would you like an A1C task cut? And make sure that the data you're using is helping to drive your message. It's absolutely critical you are speaking to the members in a way that they want to be spoken to, in a way that meets their needs and in their preferred channel, whether it be via phone call, whether it be via email, whether it be via text. And then it's always continuous assessment so that it can improve, whether it be your HEDIS, ratings, HEDIS measures, your star ratings, or your CAP surveys. You're able to have an impact still at this end of this year. So please focus on that, because we know how important it is for member experience and closing gap closures in Q4. So how does member engagement support star improvement? So here's just some of the ways that you might be able to use in your toolbox to improve members' experience is through outcomes and experience surveys. So whenever I told you those point of care, so whenever they're having a prior authorization, when they're having a hospital visit, seeing how that experience went for them. Welcome and onboarding. If you have a bad experience from the start, first impressions matter. So you really have to make sure that that experience really is meeting members' needs. Are they getting all the information? Do they know what their providers are? Is their provider in network? All of those things that they may not understand in the process when they're signing up to enroll, make sure that you have clear and transparent information shared with them, as well as supplemental benefits. Oftentimes, members don't take advantage of supplemental benefits because they just don't know that they're available to them. So make them aware of all the great things that you're offering to them and that they can utilize, and that will help improve their health as well as their member experience. Also, make sure that they're aware of any sort of telehealth. We've seen an increase in seniors using telehealth and making it available to them so that it's able to meet them whenever they need to at midnight. They don't have to go to the emergency room. They can utilize your telehealth vendor. As I mentioned, and I can't underscore this enough, is identification of social determinants and barriers to care. That is one of the key elements I've seen over my 20 plus years of working with very complex, high need populations, and sometimes often the most physically and mentally health impacted, is the ability to build trust by identifying what are your barriers to care. Can we help solve for that? Is it a transportation issue? Here's what we can do to help you. That is one of the key values to build trust with your members. Also, providing your members with incentives. Who doesn't want a free gift card to Amazon or just a free Visa card for completing a survey? they are more likely to respond, to a survey if you're providing member incentives, or for gap closure potentially with member incentives. So don't underestimate the value of member incentives. How you can impact HEDIS and pharmacy, preventative care. We can't underscore that enough. We know that it has taken a hit in the pandemic, that members are less likely to receive their preventative care. It is starting to improve, but we have seen it taking a hit. So reminding members how important it is to receive their preventative care. Also, as you all know, with the various STAR measures focusing on chronic condition management, diabetes and heart health, educating members on what their choices are with regards to food, physical activity, and how that can impact them and their health. Members are really receptive, especially we see with Medicare Advantage plan members really want to learn more and be educated about their chronic conditions. So help support that. Of course, the importance of flu. We're in October. This is one of the busiest flu call parts of the year that we have. And, make sure members remind them of their flu vaccines. That also, of course, impacts other measures that are super heavily weighted as well. And then making sure that members are updated on their COVID-19 immunizations. And, we can't underscore enough medication adherence. I know we've spoke over and over about it, but as you guys know, it's super important, and you have to start from day one. You can't let it slide and just start to see, folks that are not adhering to their medication. You have to act quickly, or that's going to drastically impact your STAR ratings, and you're not going to be able to get the STAR measures that you're wanting to have for your goals. Also, I can't underscore enough the importance of risk assessments, identifying risk in your populations, potentially connecting them to your care team, potentially enrolling them in services that may be beneficial to them. So it is really important. I think it's one of the most important things to do is to do risk assessments, and you can incorporate social determinant of health and barriers to care screenings in your risk assessments. But risk assessments are incredibly important, really can help you identify things quickly, get people connected to care, and help improve your outcomes and help improve member health. And then, as I mentioned earlier, post-hospital discharge is one of those key moments when a member may feel lost. They may not understand their medications. They may not understand what is being asked of them with their discharge instructions or what's next. And, that's a scary time for a member. And so being them when they're in that moment of need and wanting information and feeling supported is absolutely critical. And then ER avoidance is absolutely fundamental. Most, especially with COVID, most members were not going to the ER. So there has been a lot of education and redirection from the ER, but where it's, emphasizing members that, hey, it's really important to be seeing your primary care physician. The ER is not probably the best place. There are reasons why. And so member education or when to appropriately utilize the ED is super important, and it will benefit your members because they'll have a better experience. And then some of the administrative components. So as I mentioned, welcome and onboarding is still part of that. So I can't underscore that enough. Member retention, that, as I mentioned, cost of acquisition is super high, highly competitive, world that you are operating in. So focusing on member retention from day one, not to the end of the year, but day one, and every part of that member journey is focused on how are we going to keep these members, and it's easier to keep them, and it's more cost effective, and also they're likely to be more satisfied the longer they're on your plan if you're meeting their needs. And then also communicating information through ANOC, and as well as creating member profiles if you have that ability, so you can really feel like you're communicating in a personalized way with your members. So, do they prefer to receive their communications via email, or do they prefer to receive a phone call? Do they really like to have more information and get, member resources? Do they want to be communicated about what, community-based organizations may be able to meet their needs? And so really being there for members in their time of need is some of the ways that you can engage to help improve your STAR measures. And then, all of this is driven by data. So data is absolutely critical. Understand where your abrasions occur. There's a lot of health plans that I've worked with, and, there's sensitivity around member abrasion, and so that's why it's super important to leverage those member journey touch points that are absolutely critical. And you can start to just survey those points in the member journey. So whether or not when they're discharged from a hospital, whenever they've had a prior authorization experience, you can start to see where those touch points actually impact your entire member, journey and member experience score. So really map out your end-to-end view of your member journey. It could include, I've mapped out with numerous health plans. Sometimes it's more than 100 touch points in a year. And so this can help your organization create a framework and a common vocabulary among leaders to enhance their members' experience. It's no longer just about gap closure, it's about members' experience. And leaders can use those surveys to understand which of those touch points is driving satisfaction outcomes. Once these high impact touch points have been identified, customer experience leaders can solicit targeted feedback from customers on their experience of them. You have to use analytics to target these member populations and individuals, and advanced analytics can help enable you to predict healthcare spending and member behaviors, which the payer can then input into empathy maps and isolate member priorities. Payers can use this data, as I mentioned earlier, to shape their messaging. The messaging must contain the solution which the member is looking for. It must incorporate other priorities incorporated by advanced analytics, and it must be delivered in a member's preferred platform. I can't underscore, as you can imagine, your Q4 push to improve star ratings will need to focus on identifying the right members and quality measures that will have the most influence on your scores. Non-compliant members with outstanding care gaps can have a negative impact on your star ratings if not properly addressed, but directly connecting them with care they need can boost your performance across multiple measures. And then what measures you choose to target will play an important role in your campaign and engagement strategies. While you should continue your efforts to increase compliance for long-term measures like medication adherence, your campaign also has to focus on quality measures, member satisfaction that you can immediately impact in a short period of time. Narrowing down your listed targeted measures to screenings that do not require multiple appointments will help you control the scope and spend your campaign while improving your performance as you move forward. As I mentioned, you're going to have to identify the gaps in your programs. You're going to really have to map out that end-to-end journey and see where you're struggling with, whether it be medication adherence, whether it be member satisfaction. So we just wanted to save some time for questions, but we wanted to put together some quick improvement checklists that you might be able to use. We know that some members are more engaged in their health than others, while others are more at risk to miss an appointment, even if they know it should happen. Plans can make an impact on closing gaps in care and improving quality measures for things like preventative care, cancer screenings, adhering to recommended medications, and chronic condition management appointments with targeted outreaches. With the fourth quarter of 22 still in front of us, and you have to create a surge campaign, jumpstart your programs, find out where you need to really be focusing your time and energy, because we only have a small window left. Voluntary disenrollment is an all-time high. Given the continued pressure to improve adherence, even the highest performing plans will need to implement new strategies to engage higher risk members and improve medication adherence related STAR measures. In the past, broad stroke outreach and single transactions may have been sufficient, but plan and member relationships need to evolve through whole person, targeted support tailored to the individual. It needs to meet members where they are. It needs to be meaningful. It needs to be able to speak to those members, feel like they're heard, and then you're going to be able to have that impact, especially for those that are greatest at risk of falling away from their treatment plans. These are often, as you know, related to multiple social determinant of health challenges and other barriers to care. Additionally, plans can use the final quarter of 22 to work on certain areas. And here are some of our highest level of priority we've recommended. You may have other ones based upon how you performed, but we can't underscore the importance of scheduling patient and member satisfaction surveys. Kick off your flu campaign. Still, it's not too late. You need to educate your members on benefit changes, and also assess your budget. And it's time to act is now. And then we're trying to give you a little bit forward thinking. So, as you rush for Q4, what can you be doing in the next few months? So Q1, review your network and benefits with members. Make sure that first touch and that interaction, whether it be they're getting a prescription medication or they're welcome and onboarding materials, that they know and it's transparent what's occurring. Deploy health risk assessments, encourage continuation of preventative care. And I can't underscore enough, and I'm sure you guys know, medication adherence starts from the beginning. you have to continue to identify new supplemental data sources to be able to complete your measures. And so I'll ask Thelma, do you have any other things that you think that you would recommend for health plans right now as they're moving forward with their Q4 and Q1, checklist strategy?
I would make sure to get members in for appointments before the holiday rush, and also get them in for their A1C specifically before the holiday meals kick in.
Absolutely. Absolutely. I think that's a key point. Oftentimes we're trying to do it and they're trying to get in. And as you know, I mean, I've tried to get in for my flu shot through my primary care physician, and they're full. They're having, staff shortages, just I'm sure as you guys are as well. And so it is really hard to get, members into their appointments, and it's hard to get them in, to get their screenings. So it's absolutely critical. I think that's great. And I think you had some great ideas about blood pressure screenings too, Thelma, about white coat syndrome.
Oh yes, about to remember to take the members' blood pressure multiple times during the visit, not just the first time or the first touch, because they could have the white coat syndrome, which lifts their blood pressure at the beginning, or because they're nervous. So as you continue up through the appointment, if you took their blood pressure 3 times, when it's time to do medical record review, they can pull the highest systolic and the lowest systolic and diastolic from the visit. So it doesn't have to be the same one at like this first and bottom for the same blood pressure, but for the visit, they can pick the better up.
Absolutely. Thanks so much. And, I think I just want to underscore, if you haven't heard enough from me, proactive health plans that we are seeing, that we work with, that are 5-star, not waiting for CAPS results. They're proactively implementing mock CAPS or surveys outside of the blackout period to gain a more timely picture of member challenges, sources of dissatisfaction. With surveys like these, plans can also have the ability to know which specific members are experiencing challenges so they can immediately act and respond to their individual needs and concerns. This makes members feel seen and heard, and improve satisfaction, and ultimately can help boost your member experience and your star rating scores. With that, Cassie, do you want to talk about this?
Sure. Just getting myself back on video here. So after viewing this webinar, if you are looking for some additional support, we do invite you to please join us on November 8th at 2:30 p.m. Eastern Time to learn about Cotiviti's brand new Star Intelligence solution. You can use the QR code on your screen, head over to cotiviti.com, or click on the link to register in the follow-up email you'll soon receive from us. As we discussed throughout, achieving a 4-star or more Medicare Advantage star rating can be really difficult. Good ratings yield significant benefits for the plan in the form of bonus payments and improved enrollment, while the penalties for low ratings can be as dire as monetary penalties or even plan termination. So if you're looking for more help discovering a personalized path to star rating improvement, Cotiviti has just introduced Star Intelligence. And we're going to explain on November 8th how it can help you create a plan to achieve and maintain higher scores. We'll talk about the capability Star Intelligence has to enable plans to track, predict, and model their star ratings, and understand the actions to take and members to target. You'll learn how you can access a one-stop shop for HEDIS, quality, and stars management, get a clear view of progress with trending and benchmarking dashboards, leverage analytics that offer measure prediction, end-of-year predictions, trends, cut points, and opportunities for growth, and get reliable insights through our predictive cut points built into those advanced analytics. So I encourage you to scan the QR code on the screen, or we'll be sending you some follow-up materials as well. And with that, I am going to make sure we're all unmuted, and we will get started on some of the questions that came in during today's webinar. A reminder that you can still submit questions through the Q&A pane at any time. And our first question, I think, is actually a comment, and one that I think that we'd actually all agree with. It came in during your poll. It said, I have an additional item to add to the poll, which is access to care. You can't close gaps or include or improve patient experience if patients can't get into the office.
Absolutely. And I think I hit on that on my end, and thank you. I didn't even see that in the chat. But yeah, absolutely. I think we are all experiencing that. You know, we have part of our solution, we do appointment scheduling, and we are seeing that as well. We're having to really go and try to get that because it's hard there's not as many staff in the office that, you know, providers are struggling to be able to meet appointment scheduling needs. So you're absolutely spot on. It's a great call out and I appreciate it.
Yeah, great. All right, our second question, and this was one that was received early on. So Misty, another one I think that was discussed a lot. So maybe you can just give us a bit of a summary on some best practices for member engagement and retention to improve star ratings specifically.
Yeah, I think the only things that I would add, you know, I think, as I mentioned, trust with this population is extremely low. And so everything that every interaction you're having, and I know there's some regulatory things as well, but make sure it's authentic. Make sure you come from a place of empathy with members and not, you know, they're having all sorts of things kind of, I need you to do this, I need you to do that. But just be authentic and be present and identify what can we help you with? What are your barriers to this care? Is it that you can't get into the office? Is it that you live on a bus line and it takes you 6 buses to get to your provider's office? Maybe we can provide you a provider that is closer. So every interaction needs to be authentic, meaningful. It needs to have an opportunity to build that trust. And then you have to meet members where they are. So make sure that you're speaking to members in their preferred channels, the way that they want to be spoken to, receive the information that they want to receive, and also providing them resources to address any issues and barriers to care that they may have. Will fundamentally build trust. And that's kind of the common thread, just like member experience is a common thread. Building trust is the foundation to be able to improve all your measures as well as your member satisfaction scores.
Great, thank you, Misty. We had a question from the audience. Do you both think we will see more high performing or middle performing plans versus low performing plans given the change in rating methodology?
I'll let Thelma take these first. Yeah.
Well, I definitely think with the easing of the 2 and 3 star cut points, it's trying to make sure that the plans are able to score higher. However, with the 4 and 5 star cut points becoming harder to achieve, I think it actually will cause the plan to see a wider gap between low performing and high performing.
I agree completely. I think we are seeing the gap. I mean, I don't think it's ever been this big between high performing. And I think it's going to take every health plan just to step up and say, I'm going to prioritize these few things and we're going to execute and do these really well. And we're going to put the resources behind it and really focus on that member journey. I cannot underscore that. And that's where you're going to be able to identify the pain points for the members and where it's going to impact all of their care as well as their member satisfaction.
I think those are great points. We are actually at time. So for those questions that we weren't able to get to today, thank you guys. Thank you all for submitting them. We'll make sure to follow up after today's webinar. And I will turn it back to Tracy with Rise to wrap us up. Thank you so much.
Thank you.
All right. Well, big thank you to our speakers and of course our moderator and Cotiviti for helping us facilitate today's webinar. So thank you guys. I know we do have a few more questions, so go ahead and put your questions in and I'll make sure I forward those over to our panelists so they can reach out to you all individually. As long as you haven't submitted your question anonymously, I'll make sure that gets forwarded. But thank you all again for attending. We will be sending out the recording and the presentation deck. You can expect that a few days after the webinar. So look for that in your email. I'm going to launch the member experience survey here in a second, but thank you all. Enjoy the rest of your day and the rest of the weekend if we don't see you. Bye, everyone.
Thank you.